everyone, and welcome to our podcast. I'm your host, Dr. Harshita, and today we have the pleasure of hosting a distinguished guest, Dr. Himanshu Kumar. Dr. Himanshu is a board certified dermatologist with a wealth of
Hello.
experience and excellent people skills. Graduating from reputed government medical colleges in India, Dr. Kumar has over 9 years of experience and currently serves as a consultant dermatologist in his own practice. He has a special interest in dermatosurgery and clinical dermatology. Today, we are honored to have him join us as we delve into insightful discussions about eczema, dandruff, and winter skincare. Welcome, Dr. Himanshu. It's a pleasure to have you with us today.
Hey, thanks, Dr. Harshita, for the wonderful introduction. And I'm happy and quite excited to talk about the winter skincare and specifically these conditions which tend to get, sort of worsen during winter season.
Yeah, thank you, Doctor. So, before we get into the specifics, Dr. Himanshu, I think our listeners would benefit from understanding the basics of eczema and how it manifests. Can you provide some insights?
Firstly, talking about eczema. So eczema is, a broad term. It's an umbrella term. When we talk about eczema, in simple words, eczema is any condition where we see these red, itchy rashes, and sometimes these rashes can be oozy, meaning they can be wet, and sometimes these can be dry. When I talk about this being an umbrella term, there are different types of eczema that we encounter in our clinical practice. But just today's discussion is mainly about winter eczema related to winter season. So I'll be covering three main types of eczema today. One is called atopic eczema, which is your atopy meaning allergy. So atopic eczema is mainly seen in children, but sometimes it can also persist into adulthood. In atopic eczema, we tend to see rashes mainly around the face, on the neck, and then on the folds of your body, which is on your arms, behind your knees. So these areas. The second type of eczema that we're going to talk about is called seborrheic eczema. As the word says, it's mainly involves the seborrheic areas of the body, which is your more sebum-rich areas like your face, again your scalp, and the back and chest. The third eczema that we're going to discuss is astatotic eczema, which is dryness because of the main cause is dry skin. This one we tend to see more in elderly people because as we grow older, we tend to lose we tend to lose water from our body. We tend to lose, and the skin tends to become dry gradually. So these three types of eczema that we're going to talk about today, more or less all these three, the common trigger is definitely going to be dry skin. So in winter season, all of these three eczemas can get worse if anyone has pre-existing eczema of any of these three varieties.
Yes, thank you, Dr. Himanshu, for shedding light on the fundamentals of eczema. And now, as we are moving into winter and dry skin becomes a common concern. So, what are your top recommendations for maintaining adequate skin hydration to prevent and alleviate eczema symptoms?
Central to eczema is, just like you said, it's dry skin. Dry skin, again, sensitive skin, and certain triggers, factors that can make eczema worse. Hydration is step one of preventing eczema, of treating eczema. When we talk about hydration, the number one things that comes to mind is usually using a good moisturizer. When we talk about moisturizers, the main ones that we recommend for people with dry skin or people who are prone to developing eczema is using moisturizers with these 3 or 4 different ingredients. You can use an oatmeal based moisturizer, you can use ceramide based moisturizers, or your basic moisturizers that have light liquid paraffin, white soft paraffin, All of these moisturizers provide very good hydration through the skin. Also, what's important is when to use a moisturizer. The number one, use it at least 2 to 3 times a day. What I tell my patients who have eczema is less is more. So the more you apply, the better it is. So when I say 3 times, it's actually you can use it like 4 or 5 times a day if you have very dry skin. So there is no set times how many times you should use a moisturizer. The best time is in the morning, when you immediately after your shower, when your skin is already sort of slightly moist. So that is one very good time to absolutely use a moisturizer, when the first time in the morning.
Yeah, great
Yeah.
advice, Dr. Himanshu. And staying hydrated is indeed crucial.
Mhm.
So, on the topic of skincare routines, many individuals enjoy warm showers, especially
Mhm.
during the colder months. How does the temperature of water during bathing affects the skin, particularly for those with eczema?
Right, that's a good question, and that's a very common question that my patients also ask. That number one, should I shower or not? And then number two, what kind of water should I be using? Um, Before I talk about showers, I forgot to add one very basic, simple point: is drinking a lot of water, because that water is also going to hydrate you inside out. So do remember to drink a lot of water. Now coming to shower. So winter season, everybody loves a hot shower, and but unfortunately, people who have very dry, sensitive skin, or if you have eczema, um, hot water is going to kind of make it worse, because hot water strips your skin of the essential oils, which in turns makes it more dry. What hot water will also do is it's going to cause a bit of irritation on the skin. So it's going to increase the already inflammation or redness that you already have on the skin. Um, so while you in winters, I'm not gonna ask my patient to go ahead for a cold shower, but always try to strike a balance. Maybe use a lukewarm water, somewhat on the warmer side instead of hot showers in general. Um, the second thing that's important is to keep your showers brief, short, and just quick showers as possible. Don't spend too much time in the shower. Um, Third advice is regarding soaps. So what we recommend for people with eczema sensitive skin is to go for gentle cleansers, milder soaps. If you use a shower gel, avoid using a loofah, because that is again going to rub on your skin, and that's going to remove all the essential oils that's good for you. So avoid loofah, use gentle cleansers, a pH balanced soap. Try to stick away from heavily fragranted soaps, heavily fragrance soaps or washes, because they might cause reaction or increase your already inflamed or itchy areas of the skin. So just to summarize, go for lukewarm waters, gentle soaps, avoid loofah, take quick showers, and then when you finish your shower, just simply pat dry. Do not use the towel too vigorously on the skin. Simple soft patting drying is more than enough, and that's quite advised too. Yeah.
Yes, thank you for clarifying that, Dr. Manchu. And it's essential to strike the right balance.
Mm-hmm.
And moving ahead, dandruff is a common concern for many. So, what
Mm-hmm.
factors contribute to dandruff, and are there any at home remedies or habits you recommend for its management?
Okay. So before I discuss this dandruff and what it is, let's start with because dandruff is so common. I mean, I think it's very common, and patients are very distressed because of dandruff. Unfortunately, there is no permanent cure for dandruff. Um, let me explain what dandruff is. So, dandruff is essentially your shedding of the skin from the scalp. Now, some amount of this shedding is absolutely normal and expected, but people under certain, and because of certain conditions, genetic, environmental, and just the makeup of the scalp, they shed drastically more than the normal amount, which is why we get these excessive white flakes on the scalp. And when it gets really worse, these flakes tend to be itchy, and then they can also cause rashes over the face. What is sometimes very central to this is overgrowth of a certain yeast-like fungus called malassezia. So, in treatment of dandruff, we often use these antifungal shampoos called ketoconazole shampoos. So, now that we know what dandruff is, I'm going to talk a little about some things that we should avoid if you're already suffering from dandruff. Number one thing that I encounter in my practice is patients use hair oil. In hair oil, if you use oil, your dandruff is going to get worse. So I'm going to suggest, probably what I suggest my patients is use oil, but maybe once a week or maybe once every 2 weeks. Stick with thin oils like coconut or olive. Stay away from mustard, almond, or any of these, essential oils, Ayurveda oils, and things. The second thing is to also not use hair creams, hair wax, anything that will, trap the moisture in the scalp. So oily scalp will make your dandruff, will also make the dandruff worse. So keep it well. Don't use any oils, creams, waxes. Then, in terms of what shampoo to use, like I mentioned, ketoconazole shampoos are very good at controlling dandruff. If that doesn't help, there is other options as well, like anything that has zinc parathion, anything that has selenium sulfide. Most of these shampoos are available over the counter as well. But again, if these things are not helping, in case of severe dandruff, we do have other options. It's best to meet a qualified dermatologist in your area for that.
Yeah, and now, doctors, speaking of psychological aspects, how do you counsel patients on the psychological aspect of dealing with dandruff, and what are the effective treatments for severe cases?
So certainly, dandruff is, like we just talked about, it's a chronic condition. So the first step is to kind of make our patient understand that it's absolutely normal. Everybody has dandruff. It's just that some people, have this excessive dandruff. B, it's absolutely treatable, but you have to keep using the shampoo. You cannot stop these antifungal shampoos, because once you stop, there is a chance that this shedding will increase again and you'll again develop these flakes. So stick with the shampoo. Use it once or twice a week as sufficient for you, as you feel it helps you. Then there are a few things that can make it worse. Like I mentioned, oil stress is another thing that makes dandruff worse. So manage stress with meditation, yoga, however it helps you or you seem fit for yourself. But these little things can make it better and also help you deal my patient with the psychological stress of it. So just understanding that it's normal and it's treatable, and if we just have to stick with a regular use of anti-dandruff shampoo, goes a long way dealing with the psychological stress of it.
Thank you, Dr. Himanshu, for sharing your valuable insights on managing dandruff, including the psychological aspects. Your expertise adds immense value to our discussion. We appreciate your time and the wealth of information you have provided.
Thanks. My pleasure. Thank you for this. Yeah.
And to our cherished audience, your support means the world to us. Before we sign off, I would like to invite you to explore the MedSynapse platform. It's not just a resource, it's a dynamic space where you can connect with esteemed medical professionals, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, take care, stay informed, and keep advancing on your medical journey. Goodbye.